Okay, so I chose to do my topic on peptic ulcers. A peptic ulcer is defined as a lesion in the stomach or the small intestine, in the beginning of the small intestine. It differs from Crohn's disease as it's not something that's progressive. You can get a peptic ulcer and then it can clear up and you can never get one again, or you can continuously get peptic ulcers depending on your lifestyle, diet, smoking. The main thing with peptic ulcers is they can be caused by a bacteria called Helicobacter pylori. So when you present to the gastroenterologist with symptoms of nausea, regurgitation, discomfort in your chest, they first will ask you a series of questions. If you use non-steroidal anti-inflammatory drugs, if you drink, if you smoke, if you're under a lot of stress, these are all indicators that you could have a peptic ulcer. If you use NSAIDs, things like aspirin, Advil, naproxen for a long period of time, that can cause a peptic ulcer as well, and that would be considered non-Helicobacter pylori peptic ulcer. The best way to kind of diagnose would be if you have bloody stool without something invasive, bloody stool, throwing up blood, without any evaluation, it's pretty evident that you have a peptic ulcer. If things are a little more complicated and it's not actively bleeding, you could do something like an endoscopy. A breath test would be able to identify Helicobacter pylori, as well as a blood sample would be able to look at antigens, I believe, for Helicobacter pylori. It is the bacteria of Helicobacter pylori that drills through the lining and thins the lining of the stomach and creates ulcers. The typical treatment for the medical treatment for Helicobacter pylori would be antibiotics, something like Pepto-Bismol, bismuth, and it's a Prev pack. It's a 3 combination, bismuth and a PPI. So PPIs will decrease the stomach acid while the antibiotics kill the bacteria. And the bismuth also kills bacteria and plays a part in lowering stomach acid as well. If you want to go a natural alternative to that, cabbage juice has been shown to prevent something like licorice root, ginger shots. That also heals the gastric lining without having to bombard your body with antibiotics to kill all the bacteria. There's also stomach ulcers without Helicobacter pylori that could be caused by alcohol consumption, smoking, and these are a little bit easier to treat and don't require as much follow-up. So you would need to do something like a PPI or an H2 blocker, decrease spicy foods in the diet, decrease alcohol, and usually they clear up pretty quickly. Depending on the severity of the actual lesion that they see through an endoscopy, depends on how long your treatment would be. People with a lot of comorbidities, drinking, smoking, they have a higher prevalence of having things like stomach acid or having stomach ulcers. People who have more alkaline Mediterranean diet tend to not have as many stomach ulcers unless they were taking NSAIDs for a long period of time. The doctors do give you 800 milligrams ibuprofen without counseling you on the non-steroidal anti-inflammatories lower your prostaglandins. Prostaglandins are really important for creating the mucus layer in your stomach. So when you're lowering your prostaglandins to make that mucus layer, it's not working as effectively. Therefore, it increases your risk. It also thins your blood, but it does increase your risk for developing peptic ulcers. Smoking also increases your risk of contracting Helicobacter pylori. But mastic gum, ginger, things like licorice, glutamine. I know Metagenics came out with a product with aloe vera, glutamine, and licorice root to coat the stomach and help heal and prevent peptic ulcers. Some people with chronic GERD, they're actually dealing with an ulcer, but they think that it's GERD. Nausea, it really just can present anywhere in the esophagus. But usually they're treatable unless you have antibiotic resistant Helicobacter pylori. In that case, you would have to have multiple rounds of antibiotics, or if you want to try natural treatment, things like olive leaf and oregano oil can treat it. There's not so much data on that. Most of the data is on a Prev pack, which is the combination of the three PPI, I believe clindamycin, and a bismuth. So that is the research paper final video, and I hope this uploads.